Joining us this morning, our friends from Titusville Area Hospital, Holli, Wolfe, somewhere in the studio. There you are. How are you?
I'm great. How are you, Luke?
Good to see you this morning.
Good to see you.
You brought in a special guest this morning.
I did, and we're socially distancing here, so we're doing things a little bit different this morning. I brought in our new speech pathologist. Her name is Ahrens. She's going to be doing speech therapy at the hospital. We are so excited to have her. We have had a part-time speech therapist for some time. We contracted that service out, and now we have hired a full-time person. So we're really hoping to grow the business. And you know, there's so many kiddos that can benefit from speech therapy. You know, people that have had strokes and things like that. So we're really hoping to get out and get information out about Ashley and our program that we have now at the hospital. So we'll be able to see outpatients and of course all the inpatients in the hospital as well. So I brought her on to explain some of the benefits of speech therapy.
And socially distanced. There's Ashley. Hi, Ashley. How are you?
I'm good, Luke. How are you?
Good. Nice to meet you. Welcome. And tell us a little bit about yourself.
Well, I'm from Oil City. I'm pretty involved in my community, but outside of work, that's really what I live for. So I'm involved in a couple of nonprofits. I'm the head coach of the Freiburg Junior Marksman, which is a rifle program out of Freiburg. So that takes a lot of my time. I'm on the board of Clarion County Sportsmen's for Youth, and I also run a local chapter of Wreaths Across America in Lucinda.
Very cool.
Yeah.
Busy life.
Very busy, yes, but I wouldn't have it any other way.
Yeah. Well, how did you get involved in this profession?
You know, Holly asked me that question when she interviewed me, and I told her that I don't really have an awesome, emotional story. I kind of just picked it off a list and thought, well, this sounds cool. Let me see what this is about. And I had my first class as an undergrad freshman, and I just got hooked on it, and it fit, and it felt right. So 6 years later, I had a master's degree, and this is where I am.
Well,
so.
Congratulations.
Thanks.
And as Holly kind of pointed out, the age range is all over, so I'm sure every day is a little different for you.
Absolutely. That's one of the things I love about my job. So on Monday morning, I can treat a newborn baby that's not feeding properly, and the next day I can treat a geriatric patient.
So it actually starts at that level?
Absolutely.
Not feeding properly? Really?
Yep. The day that an infant's born, they can call in a speech therapist for a consult for feeding issues or a cleft palate, for example. So we treat people of all ages.
Wow. Okay, so let's get into some of this because we know, especially, let's start young with and I wasn't expecting that, so that's very interesting. You have kids who have problems. They go into school. This hurts them in learning and communicating, doesn't it?
For sure. So what we know for a fact, what research has told us, is that if a child receives speech-language services prior to entering preschool, it takes 4 times more therapy for them to achieve their maximum potential after 4th grade. So any kind of intervention that you can provide prior to starting school is going to make a world of difference.
That would make sense because that's about where I graduated, 4th grade, somewhere in there. It's thrown out. So what challenges then would come afterwards?
Well, for some kids, speech-language services is something that continues until the day that they graduate. Some kids receive speech services for feeding issues. It really depends. Every kid is different, and depending on what kind of diagnosis we're looking at, therapy is going to vary throughout a lifetime.
So what... Holly mentioned stroke victims and helping adults or seniors. Again, another set of challenges there.
Yes.
How is that different than maybe working with youth?
So anytime I'm working with a pediatric patient, I am giving them skills that they've never had before.
Okay.
And typically in geriatric patients, we're restoring function that they once had and then lost due to, a disease or an accident or something of that nature. So you're repairing function versus giving that to them in the first place.
And you're talking about patients who probably get very frustrated.
Oh, yes.
Regardless of the age, right?
Yeah, absolutely. I mean, imagine if you weren't able to effectively communicate and you were in a room filled with people and you had so much to say and you had your own thoughts and you knew what you wanted, but you couldn't tell me. And that's when we typically see behavioral issues in children who have expressive language issues because they are frustrated, and it makes sense.
Holly, this sounds like it's a fantastic program for the hospital. So how does somebody get started with this process?
So you would need a referral from your physician. A lot, the peds office, where we work with them as well, and if you're an adult, of course you're going to have a new diagnosis, and your physician would send the referral over to the hospital for that. If you have any questions or think that maybe this would be a great opportunity for my child, or would like an evaluation done, you can always call the hospital to find out more information about that. It'd be 827-1851, and then Ashley's extension is 3830. So, or you could just call the hospital and ask for a speech therapy department as well.
Is this something that could go hand in hand with school district? So maybe, because they have people obviously who work on speech there, but if there was a student that needed additional help, is this a direction they could go?
Absolutely. Yep. Yep. We can help supplement that.
Okay. So Ashley, is that kind of neat to have those relationships as well, where you're almost tag teaming to help a patient?
Yeah, absolutely. It's all about collaboration, and I'm used to having a kiddo who has multiple therapies. So, it could be OT, it could be PT, it could be nutrition. So, consulting with those other specialists and saying, here's what I'm working on, how can I help you with what you're working on? So it's definitely a team effort.
And go back to the frustration part. I mean, as a kid, when you're trying to communicate with a parent, a sibling, a teacher, and that's not getting across, that is very frustrating. What happens to somebody at that age when that issue comes up? Do they start retreating? Do they, I guess, kind of describe that process?
Yeah, it's different for every kid, but for the most part, when it gets to that point, they're outside the principal's office because they hit someone or they bit someone, or they're not able to express themselves verbally, so I'm going to hit you instead, because that's something that I can control, and I can tell you that I'm mad at you if I punch you. So these kids that have a lot of behavioral issues, that's typically something that I immediately look for is, are there expressive language issues? And if so, can I give them a different outlet to help them express themselves?
You just described Holly, I think is what... We'll get to that in a moment. You're watching the Morning
Drill. That's why
we're
starting the speech therapy program. I'm the first patient. No.
You're watching the Morning Drill on Stream Television and on Armstrong's Neighborhood Channel, listening to it on the Allegheny News Talk Sports Network, here with our friends from Titusville Area Hospital. Holly, this is a great addition, as we mentioned, to the hospital. What other things are happening, and what are you working on?
We're still working on the ED project. We are towards the end of phase 3. We have 4 phases, so we are so close. We have to, of course, get through phase 4. Phase 4 is going to be the most difficult phase in that you'll have to patients coming in for at least a few weeks will have to enter through the main entrance of the hospital, because we will be doing the overhang and working on the exterior part of the ED entrance, putting the ramp in. So it's going to make things a little bit difficult. Ambulances, all of those are going to have to pull up front and use the main entrance. So we're going to have that staffed with a triage nurse right at our front entrance, to help those folks as they come in, and of course we'll have signage everywhere directing folks to get to the emergency department. So that is going to be a difficult stage, but we will certainly get through it like we have all the others.
So we looked at pictures a couple months ago, and it looked amazing. What can you tell us? What's been the response from the doctors, the nurses, the folks using the facility?
I think in the beginning they thought, this isn't really going to happen, because they've been told, we're going to renovate the emergency room, and the renovations in the past had been a new coat of paint. So clearly we are... Which
has been nice.
It is. A new coat of paint always freshens, the room up and definitely makes a difference. But of course our primary issue has always been the privacy, and so a fresh coat of paint is not going to add privacy for those patients. So, being able to add the doors and the walls to make the individual rooms has just made a world of difference. And so the response from the physicians and the nurses, they are all extremely thankful. Patients are happy because we have that privacy now. So.
And from the client side of things, the patient side of things, you just mentioned that it's been nice for them.
Yeah.
So what should they know then, in addition to those changes? Again, it's almost like the conversation you have with folks who are working at your grocery store, those essential employees. Be kind when you come in. It's already a stressful situation with everything going on.
It is. And we're taking all the precautions as far as COVID, and people just need to be patient, and they have been. I mean, people have been very patient, very understanding, knowing that we are trying to make the emergency department better for their care, so people have been really good.
The numbers, they've been they've been building. So are people getting over that fear of coming into the hospital? Because if you have something going on, don't ignore it.
Absolutely.
Right?
Yeah, and we our numbers did start to come back up in June some and continue, but I think that some folks had waited so long for preventative care, especially going to their family physicians, that they became sick. They got ill because they put it off for so long, and of course that's what we're always concerned about, and trying to let people know that it is safe to come in, and we are always here to serve them. So don't put that off. That's something that I can't stress enough. If you have a doctor's appointment, you need to continue with that, unless you're so sick or you think you have COVID. Always those types of things, please call in, but if you have a preventative appointment scheduled, we certainly want you to continue with that appointment.
Should they call their doctor first?
Yes.
Okay.
Yep, absolutely.
And don't be afraid to call your doctor.
Right. Yeah.
We've heard those stories where people are like, wow, they're probably overwhelmed right now.
Yeah.
Call.
Yeah, absolutely. Yep,
Okay.
We're here to help you.
Back to Ashley here, and your thoughts on just joining the hospital and the folks that you've been working with.
Yeah, everybody has been so friendly. I look forward to the day where I can match whole faces with names instead of just eyes and eyebrows, but everybody has been so friendly, and it's been a great experience thus far. So
You haven't had anybody come up where they've printed their own mask and it's like a face, and it's just, it's kind of weird, right?
Yeah, we have not. We don't have any of that at the hospital yet.
Okay.
So, when they come in, we do give all of our employees new masks. So, just to make sure that they have been, that they're fresh and that they've been washed and they haven't been worn for the last couple days in a row, out in different places. So, all of our employees do get fresh masks every day when they come in.
Does that make that challenging for you, Ashley? And in all seriousness, you need to see how they're forming, their words, and you need to see that, right?
Mm-hmm. Yeah, it's definitely a challenge, especially in pediatrics. Articulation therapy, so working on specific speech sounds, a lot of the times that session starts with, look at my mouth, do what I do, so it's really hard. Swallowing patients, obviously they can't be wearing a mask if you're doing feeding therapy, so trying to limit your risk but also be able to do your job, it's really a balancing act.
And again, you're seeing all different age groups. So what's the best way to go about contacting you? Is it through the main line, Holly, or is that through your doctor again? How?
Yep. Through, you can call the hospital to learn more. And then obviously, we would need a referral to be able to do those treatments. And, Ashley has come to us with a lot of experience on the outpatient side and some experience on the inpatient side as well. So we're really happy to have her and think she's a great fit for us.
You always find great people.
I know.
We're going to just talk about you in front of you. Is that okay?
It's perfectly
Okay.
fine, yes.
Well, what excites you? What are some of the challenges that you enjoy taking on every day?
The whole thing is a challenge, and that's okay. That's what I love about my job. Every patient is different. Some of them are more willing to participate than others. So I have to say I love the difficult ones that tell me to get lost in the beginning, and building that rapport and, encouraging them to participate in therapy. So kids in and of themselves are a challenge. So it's always...
Never gets old, does it? That moment when they've been telling you that they can't do it, and then they do it, right?
The light bulb turns on. Yeah, that's the moment that you live for as a speech therapist, the aha moment.
Yeah, I don't think people understand how important that is. And our youngest had a few issues and went through some speech therapy, and you could just tell that switch went on, when he was starting to get things, and life was so much better. I mean, it sounds stupid to say that, but I mean, it's true.
Yeah, and just because your kiddo receives speech therapy doesn't mean that they have a diagnosis or that they're going to need help later on.
And that's what we thought too, right? But it's these little things that you find out, if you don't fix it now, down the road it could turn into this or this, and that's what you're trying to prevent.
It's so much harder to fix at a later age. Kids are so pliable when they're young, and their brains have so much growing to do. So it is 100% the best option to get in there early and start therapy and just be done with it early, instead of waiting until 2nd, 3rd, 4th grade when, it's harder to change those habits.
Yeah, absolutely. Or 40. Holly, anything else we should know before wrapping up this morning?
We have Dr. Matthews starting in August. I know Lee talked about her last month, so we're excited to have her. She made the transition from Colorado, and now she's here, and we're excited to have her start. She's a family medicine physician that loves rural health, so she's in the right place for sure.
And again, if folks want to learn more or start scheduling appointments, they can call the hospital for that?
They'd call the hospital, 827-9770.
All right.
Yeah.
Holly, you always ask, why didn't I ask you what you learned today? So I'm going to do that, but we'll start with Ashley. We'll throw her under the bus first. What did you learn today, Ashley?
What did I learn today? Well, today was the first day that I got to the therapy department without getting lost on my way there. So I'm taking it as a win.
Enjoy that moment.
Yeah.
Holly, what did you learn today?
Well, I learned that newborns could have speech. I had no idea.
I didn't either.
A newborn. I mean, that's definitely my light bulb moment for today. That I learned something.
Well, good to see you.
Good
Ashley,
to see you.
Best of luck with everything.
Thank you.
Thanks for coming in.
Thanks.